My name is Carol Brusigar, and I am 62 years old and in a situation where I'm holding my breath and hoping nothing catastrophic happens to me before Medicare kicks in. I think this is a situation that many people may be in if they have changed careers or are trying to build their own businesses, or for some reason are without health care which is paid at least partly by some company, corporation, or organization. That's been my situation for about 9 years, and for 6 years I went without any coverage at all. Luckily I'm very healthy, but you never know. So now I am paying privately to have coverage basically for catastrophic situations. So if something not catastrophic happens, I'm going to be paying out of my pocket, which is going to be catastrophic for my economy because I'm working very much hand to mouth right now as I build a business. So I'm very much in support of healthcare reform, and I think single payer is a very good solution, at least to start with, because what we have right now is leaving way too many people uninsured, and it's situations like mine where you're just holding your breath and hoping nothing happens.
Hi, I'm Marie from Irvine, and I have to say that I'm very fortunate with my health care because I have employer-paid health care here at the university in my staff position here. And so I know what it means to have health care. I know what it means to rest easy at night. And I've had a couple of close calls with my health that have been taken care of very easily because I could just go to my doctor and I didn't have to worry about the $40,000 I was going to have to come up with to pay for the surgery here. So my concern here is that this is a human right, that the whole country deserves to have what I have. And I know sometimes it's said that, well, those of us who have health care are paying for those who don't. Well, I think those who don't have health care are also paying for those of us who do, who are public employees and have these very generous plans. My brother is a photographer with his own business, and when he turned 60, he just couldn't afford the premiums anymore. And he just told me, well, I'm going to die, because he just had to take a fatalistic approach to it. And I think, that's very tragic. My older sister told me last night she's in the donut hole and is trying to decide, which medications to stick with here. So these are things that I think it's a very dark side of America, and I think the most practical way to deal with it is to have Medicare for all, and maybe there's a role for private health care to play in insurance, in life insurance, and some of the other things where they can pick and choose, but you can't pick and choose health care. So I support the single payer plan, I support Medicare for all, and I think it's the most practical and cost-effective way to go. Thank you.
My healthcare story really involves my children, and particularly a child that has special needs. She is deaf, and when we learned that she was deaf, we had never known a deaf person before and didn't know what we had to do. And the first thing we found out was that your health insurance doesn't cover hearing aids, because most of the time they're thinking about senior citizens rather than children who have a low incidence hearing loss. Doesn't cover hearing aids, doesn't cover the speech therapy that they will need for their entire educational life so that they can learn to talk and to maximize their use of their hearing aids. I think that that's probably true for lots of illnesses and things that can happen to people, that you don't know what's covered until you're affected by a particular illness or a particular disability. So that really is the healthcare story that has impacted my life, greatly. And I would certainly like to see coverages that recognize that lots of things happen to people, and that there need to be coverages in place that recognize that.
Hi, my name is Anita, and I am absolutely in favor of healthcare reform, and I want to tell you why. I have a healthy 28-year-old son who, because he indicated on a healthcare form that he had once had a fever and not gone to get healthcare, could not qualify for the lowest rate of healthcare insurance, despite, as I said, being a perfectly healthy kid. I'm in favor of healthcare reform because my brother lost his job and he's exhausted his COBRA benefits, and because he has significant health problems, he is looking at a massive healthcare cost. I'm in favor of healthcare reform because my brother's daughter is also in need of health care, and because he has now an income that's slightly over the level where she would qualify for healthy kids, he's again looking at a huge cost. So I'm urging everyone to be in favor of health care reform. Thank you very much.
So from my point of view, I'm an emergency room physician, and it's extremely important for me to know that the resources are there when people need them to come into emergency. And I know many ER doctors are in favor of what's known as single payer or a Medicare for all type system. I myself am for that, and it's a system that seems to make the most sense to me in terms of providing care. It takes out a huge portion of the healthcare dollar is wasted in administrative costs, and it wouldn't cost us anything more in terms of our own personal resources to have a national plan like a Medicare for all single payer system.
In 1974, we were in England on a sabbatical, and our one daughter got pretty ill, and we didn't know how to find a doctor, and our neighbors said, "Oh, here, we'll get one for you." And the doctor ended up coming to the house where we were renting, and at the end of the visit, our question to him was, "How much do we owe you?" And thinking, "Oh my gosh, he's made a house call, this is going to cost a fortune." He said, "You don't owe me anything." And we said, "What do you mean we don't owe you anything?" He said, "You're a guest in our country and there's no payment due." Keep in mind, this was 1974, and how progressive they were at that time. If only that could happen here.
Training programs. Healthcare in the United States, when you get to it, is great, but to be able to get to it is very hard. You're turned down automatically. If any way they can get you to wait the 24 to 32 days, they will do it. It happened to me 2 years ago to get reorganized. They didn't send me anything out. I passed the due date. It took me 2 months to see another doctor. This year, as soon as I got my letter from my doctor, I started. I had to end up 2 days before it ran out, before my surgery. I couldn't have had my surgery. If I didn't, I had to call 5 times, 4 different people, and the next day I got a phone call back. So just please listen, we need help, especially for, there are some people really hurting and dying out here, so please contact us. We need your help. That's what we're Americans. Thank you.